And I now give the floor to His Excellency Jagat Prakash Nadda, Minister of Health and Family Welfare of India.
Mr. President, Excellencies, ladies and gentlemen, I am happy to join all of you today for this high-level meeting on HIV/AIDS. I also commend the efforts of the permanent representatives of Switzerland and Zambia for steering the difficult negotiations of the draft declaration to a successful conclusion. We have come a long way in our collective fight against the spread of AIDS epidemic that had engulfed large sections of population across the world. Strong political will and concerted targeted action over the last decade and a half have contributed to strong achievements in pushing back the epidemic. The number of HIV-affected people living on antiretroviral therapy has increased substantially, and the number of annual AIDS-related deaths has gone down considerably. These remarkable successes have demonstrated that the target of ending the AIDS epidemic by 2030 is realistic. Sustained political commitment and action is necessary to address the scale of challenge that still lies ahead. India, which faced the specter of disastrous consequences on account of AIDS epidemic 15 years back, has been able to manage the challenge effectively. Deaths due to AIDS have been reduced by nearly 55% since 2007. New HIV infections have been reduced by 66% since 2000, and around 1 million people affected by AIDS are currently under antiretroviral therapy. Targeted interventions based on close collaboration with the empowerment of communities and civil society with appropriate funding from the government have helped to deliver the key life-saving services to the affected population. These remarkable successes would not have been possible without the access to affordable medicines. The low-cost generic medicines produced by the Indian pharmaceutical industry have been instrumental in scaling up the access to HIV treatment not only in India but in other parts of the world, especially in the developing countries most affected by this scourge. More than 80% of the antiretroviral drugs used globally are supplied by the Indian pharmaceutical industry. The accessibility and affordability of drugs has helped save millions of lives around the world. Mr. President, India is proud of being one of the leading partners in the global fight against AIDS epidemic. We are collaborating actively with a range of partner countries and stakeholders, including UNH. I, along with a number of African colleague ministers, discussed various aspects of this issue at the special multi-stakeholder event on the sidelines of the 3rd India-African Forum Summit hosted by India last October in New Delhi. Only a few days back, at the 69th session of the World Health Assembly in Geneva, my ministerial colleague, on behalf of the BRICS ministerial grouping, hosted a very well-attended discussion on the importance of affordability of medicines. Also, last October, the BRICS health ministers reinforced their commitment to put their countries on the fast track to end the AIDS epidemic by 2030. Mr. President, I would like to propose 5 ways in which the global family can act together in the next 5 years. Firstly, we agree that we must adopt a fast-track targets proposed by UNH. Reaching 90% of the people in need of HIV treatment and prevention must be our primary goal. Prevention not be forgotten, even as we provide treatment for all people living with HIV. This is a time when we must maximize the impact of all known prevention and treatment efforts. HIV service delivery can become a model for expanding health coverage to all aspects of health. Second, increase investments. The role of international assistance and cooperation cannot be underestimated. This is the time for developed countries to do more, not less, and enhance their commitments. We cannot afford to give the epidemic a chance to rebound. Third, ensure access to affordable medicines and commodity security. India is committed to maintain the TRIPS flexibilities. We reiterated this commitment last year during the third India-Africa Summit, responding to the call of our brothers and sisters in Africa. Fourth, by creating an inclusive society that values every human life. Our success in targeted interventions comes from the belief in restoring the respect and dignity of individuals. At-risk and vulnerable populations, particularly women and girls, need protection from sexual abuse, exploitation, and violence. Societal change is slow, but we must not give up on the principle of value that all men and women are created equal. And fifth, global solidarity. We are in this fight together to end the AIDS epidemic. All forms of cooperation, including North-South, South-South cooperation, multilateral and bilateral cooperation, and collaboration between governments, private sector, and civil society must be strengthened. The multi-sectoral response to AIDS should not be sacrificed in favor of narrow biomedical approach. The only way we can decisively finish the epidemic is by being united in our efforts. Mr. President, this high-level meeting will leave a mark in history. Let it be remembered as a time when the world took bold decisions based on science and narrow divisions were buried in favor of creating an inclusive society, paving the way to end one of the most devastating modern scourges. Thank you very much.
I thank